Hey guys, well, welcome to another Nurse Outside the Box episode. Today with Nurse Laura. Laura, I'm so actually happy to have you here. You are amazing. Welcome. That's what I want to say first.
Thank you. Thanks for having me.
You are so welcome. I've met you a couple of months ago, and I was so impressed by your little bit of different nursing that you do, right? Together with cannabis and CBD. So, tell us a little bit how you got to where you are right now in this very field of nursing. You want to tell us a little bit? Love to hear it.
Sure. Yeah, it really is an interesting story because I am not not even like the average Joe that you would expect to be involved in the cannabis industry for sure. I've never even smoked a joint myself, but I was a traditional nurse for years and years. I worked, I'm from Florida. I worked in Florida in the trauma step-down unit down in Fort Lauderdale. And I worked in total hip and total knee replacements and on a neuro floor, lots of regular hospital nursing, charge nurse stuff. And then all the electronic health record things were starting to come alive. The hospital that I worked with was Cleveland Clinic in Florida, and they were going to the electronic health record and sort of asked me to help the doctors place orders. And somehow that transitioned my whole nursing career like that to more of education and clinical informatics, which I didn't even think I was interested in. But long story short, I ended up doing all of that, moving to Maryland, and then getting a job with Hopkins doing just that, electronic health record. So more of my time in Maryland nursing was with Johns Hopkins Medicine doing electronic health record, order entry, and all different types of education with physicians and nurses to get them to be able to use the computer system.
Right.
A lot of project management. It really was a great experience because it really taught me another angle, another avenue of working with people, understanding their needs and bridging gaps. Mm-hmm. So with my experience in clinical informatics, nursing, I was learning that you have these really smart people, and I'm sharing this because it's so related to what I'm doing today. You have really smart people who are experts in their field, and then there's some other thing that they don't know about and they're so afraid of, and somebody needs to bridge that gap so that they can get on board. Wow. So what happened for me was that as over time, I would develop these trust relationships with physicians and nurses, other healthcare professionals, and then I understood what they needed to do with the computer and then to bring it together so that they felt comfortable and could get their needs met by getting it done, but then to benefit the patients. You know, the outcome is that we're benefiting the patients greatly because we are improving accuracy and typos, you know, physicians and their messy handwriting. So, and really more efficient, just so many things that ended up having better patient outcomes and part of compliance and regulations and all those things. So up until about 4 years ago, that's really what I was focused on, was this EPIC project, that's the EHR at Hopkins. And I was doing all of this volunteer work on the side. I think as a nurse, being a volunteer, being a servant, is just part of who we are. And so I was always doing volunteer work, so much so that, I mean, initially out of high school, I was joining the convent, like I was going to be a nun. So, you know, service is definitely in my heart. So I was doing some work with a nonprofit called We Promote Health, Get Active Howard County, in Howard County, Maryland, and doing all kinds of wellness related, whether it comes to physical wellness, emotional wellness, intellectual wellness, spiritual wellness, a very integrated approach to how are you well, which I know really aligns with you and with what you do, right? And meeting lots of amazing people doing that. And sure enough, one day about 4 years ago, one gentleman that also volunteered with me reached out to me and said, "Hey, I have a proposal for you. What do you think about cannabis?" And I was like, "What's Or like, really, that's how, like, I mean, I've heard of weed and I knew about joints and marijuana, like I know, but I hadn't even been in the know enough to even know that that was another name for marijuana. And so, like, it's hysterical. It really is so funny. And then what happened was I was like, oh, like, me, like cancer patients maybe, but I just was like, that's not me. And I'm almost embarrassed by that now, but I share that because there are still so many people that feel that way. There are so many people that have such a stigma against marijuana, cannabis, weed, dope, whatever it is. And don't get me wrong, there are people that abuse it. There are people that shouldn't use it. There are people that it doesn't work for. There are side effects and reactions, yes. And we need more research and we need more people involved, all of that. And it's sad that it is still slated as a Schedule I drug and in the same boat as heroin, right? Because it's not like heroin. So I've come a long way because from that phone call, I started doing research and just, searching on the internet. I found Sanjay Gupta and all these different, Vice. I just started getting information and asking people I know, other nurses, doctors, friends of mine. I learned that so many people smoke weed. It's funny. I learned that so many doctors that wouldn't say on the record, yes, I would recommend this to my patients, or I tell my patients to try it.
Right.
We're telling their patients to try it and telling me once it's up and running, I'll send you patients. Because there is a lot of research, and anyone that's really interested, if you go to my website or we share my email and you email me, I'll try to share some reliable resources. There's a lot of research out there, a lot of it coming out of Israel. Israel's really big on some of that older research. It used to be taught in medical school. Like it used to be in PDR. Like cannabis used to be treated as medicine. And then, things happen, politics happen, Mexican drug cartels happen, things happen. But I have to tell you that as I've read more and learned more, I'm really grateful that I got this phone call that sort of shook me and woke me up. So what happened for me was I said, no, I'm not sure. Maybe I'll talk with you a little. And I kept my full job. I kept my full-time job. I kept doing my regular job that I was doing with Hopkins and started dabbling, not me personally, but dabbling in the information and learning more about Maryland's medical cannabis program and then the other states. Right now, there are 33 states that have a medical cannabis program. And then I think 10 or 11 that are adult use, like it's legal to use. And it definitely seems like, things are moving in that direction again, depending on politics. And I know we don't want to get into the political thing, but I can tell you that as I have moved forward, talking with my peers, nurses, talking with physicians, and talking with patients, people who were having to find medicine in ways that weren't safe previously and are now getting safe, reliable medicine, people's lives are changing. And I feel like I'm really serving my purpose. I know that I'm actually making a difference in helping people. And it's not because I'm getting them high. It's not because I'm helping them to like get an eighth today. It's because I'm talking to them, not as a doctor, not giving medical advice, but talking to patients and bridging the gap now between the doctor and maybe some misinformation or old information, the patient, and the dispensary, because we have dispensaries. I think we have 92 or so open in Maryland right now. And the dispensaries do their best to hire knowledgeable people. Many of them do not have a medical person as officially a part of their staff. they have information and they know a lot about the medicine, but they don't know a lot about the diagnoses and the other stuff going on with the patient. And so my company, it's called RN4Wellness, and what I do as like an independent contractor type person is I work with either patients directly or with dispensaries on behalf of their patients to talk with them about what it is they're already taking, like traditional medication, what their lifestyle is, similar to, I think, how you might do their lifestyle. Are they sleeping? Are they, meditating? Are they drinking water? Are they drinking 20 cups of coffee a day? Whatever it is, right? Like, what's just normal, healthy wellness lifestyle? What medications do you have to take because of what's medical history? And then where does cannabis, the one that you need a medical cannabis card for, the medical cannabis, like the marijuana plant, or a hemp-derived CBD of some sort, where does that fit in? Does it fit in? And what do you want to feel? Because, many people, even if they call a dispensary, a couple of dispensaries I work with some of the new patients, especially right now with, our lifestyle of stay at home, they'll have the patient call me, and patients will say, I don't want to get high. Like, I don't want to be a drug addict. I don't want to get high. I don't want to, do drugs. But, my doctor said this could help. And the wonderful thing is that's true. Like, you can be a medical cannabis patient. You can buy a lot of medicine in a dispensary and you don't have to get high. You don't have to inhale anything. And you can, if you want to, legally, which, it's kind of funny because at first that was hard for me. At first, I kind of came into this first part of the business, which I didn't really share that story, and there's so much, but I ended up going to work full-time with the grow in Howard County, helped to open a grow and processing and a dispensary, and then more dispensaries. I've worked almost every job, at least a tiny bit, whether it's, janitor, cleaning the floor in the grow, or cloning plants, or, watering, all different things, packaging, trimming, all different things that I just never could imagine I would have ever done. I had never even seen a cannabis plant until 4 years ago. In fact, yeah, I ignorantly thought like the leaves, the 5 leaves that you see, I thought that's what people smoked. I didn't even know there was a bud. And so, I think it's helpful that I was so ignorant and so full of a stigma when I talk to people who sadly are ignorant and so full of stigma, because I'm not trying to convince anyone of something different. I'm not making a political statement. I'm not trying to make money on whether you believe or don't believe in this as medicine. I'm trying to share information, share research, share education, bring people together so that patients can have the best, safest outcome. Because when a patient's healthcare provider says, no, I don't support you using cannabis, they go somewhere else, and then someone else gets them cannabis. And that can be 2 things. It could be a safe, reliable way where it's another provider recommending and they go to a dispensary and at least they're getting a safe product. Or it can be that they just go somewhere else, go to DC, go and get a product somewhere else that isn't a tested product that could not be safe, yeah, and is illegal. So
I love the education that you provide, Laura. You've done so much around that. I'm curious, in your practice today, right? In the RN4Wellness, that's, by the way, also your website if people want to, right? It's rn4wellness.com, right?
Oh, yes, rn4wellness.com.
Awesome. So if people want to get in touch with you, but I'm curious, what do you see happening right now? I'm also within the midst of the COVID-19 crisis that we're in right now, right? What do you see happening in your practice right now and how you work with patients and dispensers?
Yeah. That's a good question, because I think for all of us, this was a time of pivot. This was a time to really think about, what else can I do? How can I help? Am I in survival mode and just thinking about me, or am I thinking about other people, right? And so many businesses might be not to offend anyone, but they might be in survival mode. Like, what are we got to do? How are we going to stay afloat? And then a lot of businesses are, well, I can't do my regular line of business, so I'm going to make masks or make sanitizer. I mean, some of these dispensaries, I am so, not dispensaries, the distilleries, I'm so impressed with them for making, instead of making alcohol right now, making hand sanitizer. Like, I'm just so grateful that people are thinking to do that. It's amazing. And I've actually been able to get some of that hand sanitizer, or some dispensaries that were having trouble getting hand sanitizer because they're open and they're essential. But then you have nurses. So nurses, right? We're the heroes. Nurses and doctors, we're the ones right now that people are saying are heroes, because we're not staying home generally. We're out, right? Especially if you're in the hospital still, you're in a nursing home, right? You're out fighting the war on this pandemic. And I felt a little guilty that I wasn't in the hospital. You know, when this first started happening, I reached out to Hopkins and I was like, do you need nurses? I'll come back. They probably don't want me back because it's been a while since I started an IV. But that's where my heart was, right? And so even though dispensaries are essential, the type of work that I'm doing is going into a dispensary, sitting face-to-face with a patient and doing an education / coaching type of session. And the dispensary's doors are closed from that perspective. So there's no reason for me to be there and I can't meet with patients. So I did have to think about, well, what's the alternative? And Zoom, you know, and telephone consults were the way to go. And so I have been able to do some of that with some of the dispensaries that I work with. I'm a little disappointed that they are so busy, because they're so busy. They have had to pivot so much and create new SOPs and processes that some of them haven't really taken advantage of using me. Not that they don't want to, but you have to advertise enough so that your patients know that Nurse Laura is here and available in order to get an appointment with Nurse Laura. And that's been a little bit slow on the uptake. So I'm hoping that more of this, you know, social media, more advertising will help people to realize that, you know, patients can come directly to me, and that does happen. People will see something on social media or somehow come across the RN4Wellness website and they'll reach out directly. And I do a free 15 or 30-minute consultation. But the dispensaries that I work with, if patients go through the dispensary, then the dispensary will pay for my time, which of course meets the patient's needs better. So I'm really trying to figure out how I can help more people by sort of them not having to pay for my time, but still at least be able to keep, you know, things viable.
What do you say? I'm curious, right? Because you're definitely a nurse outside the box, and I'm curious, as you were looking towards the future of cannabis nursing, right? And as we're coming out of this pandemic as well, I'm curious, what do you see happening with yourself in your own work, and also for cannabis nursing in general, right? Nurses who are interested in doing more in this area. I would love to hear some of the ideas.
Yes, I think that's a really great question. Thank you for asking it. So right before the pandemic sort of shut everything down, I was trying to get more activity out there and education out there by taking small groups of nurses on tours to dispensaries, to grows, to go and have a very inside look as to what it looks like inside of a dispensary, what the patient experience is like, and how you can be a part of the movement to bridge the gap between doctors, patients, and dispensaries.
Which was awesome, by the way, Laura. Before you say,
oh, right, you came on one of them, right?
Opened my eyes completely too, so it was phenomenal. Yes, thank you.
And so I had one planned for physicians too, again, because there are groups of physicians that are cannabis recommenders and supporters, but some of them have never stepped foot inside the dispensary. They have no idea what's even available on the market. And then there are the physicians that are not cannabis recommenders, but might refer to someone who would recommend their patient. which is fine because some people just, because of their jobs, if they work for an educational institution, they're not allowed to sign up as a recommender. And so I really find it important to share that information and to get groups of nurses together. And I really kind of wanted to even have like a nursing staffing agency to do these consultations for patients with the dispensaries to help provide a better level of understanding for patients, because it's not a one-stop shop. It's not the same as getting a prescription for something, because you might buy 5 different products and 2 of those you use every day and 3 of them you use only when it's really bad. You know, there's so many pieces, and you can go online. There are lots of great groups for nurses. There's the Cannabis Nurses Network, which is based on the West Coast. There's the American Cannabis Nurses Association, which is, they're both all over, but I feel like it's more East Coast. 2 great groups with lots of information that you can join. You can take online curriculum. Dustin Sulak in Maine, he's an integrative medicine provider who does great education and webinars for very little. The webinars, I think, are even free. There's so much information out there. And that's a lot of the science and some of the research and the history. Mm-hmm. It's really hard for someone new coming into it to get the basics of what's actually available and how do those different products that are available work together to help the patient. And that's the piece that the dispensary agents know, like the people who are working on the dispensary side know that. But then again, the nurse has the patient's medical background understanding, which the dispensary agent doesn't have. So they really need to come together. Like, they need our support, but we need their support. Most people need the dispensary support to understand the products. I'm just lucky enough that I have both because of this kind of big circle that I took in sort of going from medicine around to cannabis and sort of back to medicine.
Well, and that's one thing I will tell you, for me, that I was totally surprised when I actually went on that tour and saw the amount of different ways of dispensing, right? I was like, oh my goodness, I had no clue. I really didn't. I honestly thought it was just one way, I guess, with all my ignorance too. But yeah, that was really, really helpful for me to see that.
Yeah, and so with COVID-19 being something that really affects your lungs and your breathing, quite a few people, physicians and people that are working sort of on the front lines are thinking that it makes sense to cut back on inhaling, to cut back on smoking or vaping in any way, even as a legal cannabis patient. Because if you were to come down with symptoms of COVID-19, it does seem like that irritation and inflammation, you know, maybe it could be an issue. I don't like to make statements like that. Right. We don't have science to back it. We don't know for sure. I do not take a stand on something like that without really good documentation. So I think if you're a cannabis patient, or if you're illegally using cannabis, I would say, please reach out to me. Let me help you become legal and safe. That's really important. It's really easy to become legal and safe. Right. But if you're using cannabis in any way, right, inhaling it, and you were to get symptoms or start to feel in any way short of breath or have some issues, stop inhaling. Like, it's just that simple. Find another way to use the medicine to meet the needs that you have until you're recovering. I mean, even if it were a common cold, it would be the same thing. CBD does have anti-inflammatory properties. That seems like it could be really helpful. However, there's some other information out there about ibuprofen and somehow the surfactant and the way COVID-19 attacks your lungs. Even ibuprofen is a problem. So I'm not a COVID-19 expert, but if it doesn't feel right, stop doing it. Like, that's really like, know your body, pay attention to your body, and, you know, least invasive, lowest amount all of the time, pros and cons, you know, just use common sense.
I love it. Do you see kind of the need for nurses, cannabis nurses, right, to increase in the next couple of years? I want to look a little beyond that, and then I'm curious if you would say if any nurse is interested in listening to this interview and like, wow, I want to know more. Then you've already mentioned some resources, but I guess going back to your website and being in touch with you, right, would be the best option to go.
Yes, yes. So I do. I think even if cannabis was descheduled in all 50 states, it was available for adult use, there would always be a need for the medical cannabis. So even in the states like Colorado that have, been early adopters and have recreational adult use cannabis, there still are medical cannabis programs, and there still are many people that really need the support in using and buying that medicine. They need the education, and some of them don't have access to or don't know how to read a research article, not because they're unable to read, but just because, we know as nurses, like research articles can be overwhelming. I'm a nurse, and sometimes it's way over my head. I call a researcher and say, hey, explain this to me. So we're always going to need to have someone to help support that. The challenges we still really need, like I'm really on the forefront of trying to push the dispensary, push the people that have the money in the cannabis industry to be willing to pay for it. They don't want to pay for it. They like the idea, but it's hard to get them to see the value in paying for the medical background. So nurses, sadly, I know some that were on our tour that are in the cannabis industry working for dispensaries are getting paid the same as the dispensary agents. They're getting paid, more than minimum wage, but not much, not getting paid like a nurse, not getting paid for all the time that you've had and the years of experience and your knowledge as a nurse. And it really is important. There really is a place for it. And I'm pushing hard to advocate for nurses. And we're really lucky. We have some other nurses that are out there advocating too, some nurses that are in some roles that, are trying to help more. So there definitely is a need and a place. It's hard to get started. It's hard to get started and get your foot in the door. And you might have to start, low, kind of prove yourself and then work your way up. A couple of people have taken like a manager role, which means you're doing other operational stuff more than probably the nursing and the more clinical piece. But it's just to get your foot in the door, demonstrate your worth. And I think what nurses have that is so imperative, even in this COVID-19 time, is critical thinking. I just remember they talked about that so much in nursing school. I feel like they drilled it into our heads. Critical thinking. Right. But that, we have, like, we are perfect. But this is why nurses are on the front line, because we know about hand washing. We know how to wear a mask and wear gloves. And we know how to think smart and think critically about a situation and analyze it and make a decision. Cannabis, being in the cannabis industry has helped me to be a little more gray. As a nurse, especially an early on emergency room nurse, everything was just black, white, decision, go, save a life, go, right? So I've had to kind of try to see more gray and try to look at both sides of things more. But nurses, we're perfect for this. Just it's a hard leap to take, and it might be a side hustle at first, and then you move into something bigger. So, yeah.
Awesome. Well, thanks, Laura. This was so enlightening. You said you, and some I've heard before and some I haven't. So, to everybody who actually is listening or looking at this, please contact Laura if you have any questions. Go on our website, right? RN4Wellness, and there's a lot.
www.rn4wellness.com. Nurse Laura.
There you go. Thanks again, Laura. And for anybody else, we're going to have another Nurse Outside the Box soon again. But thanks so much for listening. And let's make a difference as nurses, because I love it. Thanks, Laura.
Bye. Thank you.